In this video, I'm going to be talking about dilation and irrigation, and specifically not like dilation eye drops, but actually dilating the inferior punctum and the superior puncta. Those are two holes that exist in your eyelids that need to be opened up sometimes in the event of a tear duct blockage. So what is dilation? Dilation is whenever an optometrist or an ophthalmologist, depending on your state and how things are practiced and how things are set up and done, can use a special tool called a dilator. And this dilator tool is kind of like a sharp, pokey device, basically. A lot of times, some docs will use lidocaine or different types of anesthetic to numb the area up, the punctum specifically. And a lot of times we go to the inferior punctum. Either way, the superior punctum is a hole in the top eyelid, and you have the inferior punctum, which is a hole in the bottom eyelid that your tears drain out through. Now, when your tears drain out, this is when you blink, your lids move all the tears towards these holes. These holes have a very specific anatomy to them. So the tears go 2 millimeters down in the hole and 8 millimeters towards your nose into the lacrimal sac. The lacrimal sac then drains the tears down either through your nose or to the back of your throat. So if you have excess tears, this may be why sometimes you could sneeze, or sometimes why you might cough, or different things like that. But going back to how the dilation and irrigation works, is that lidocaine or some type of anesthetic is used to numb up the hole, the inferior punctum typically, and then the dilator is used to open up that hole just a little bit, kind of like a roto-rooter. It just kind of opens that hole up a little bit more for the syringe, usually filled with saline, to kind of push fluid through to open up any blockages that exist in the lacrimal sac, the canaliculus, which is the tubes that the punctum drain into, both the superior and the inferior. Now, a lot of times saline is the best use for this because this is literally trying to push a blockage out through a pipe. I mean, you got something stuck in the pipe and you need to push it on through. So there's not really a good way to use like a plunger to suction it out because it doesn't usually go back up it very well. But usually if you can push enough saline fluid through to unclog the blockage, that usually is going to help fix whatever excess teariness there is. Some people don't have an inferior punctum. Some people don't have a superior punctum. Some people even have two inferior puncta, or two superior punctas. It kind of depends on the anatomy and genetics and background of that person. Dilation and irrigation is extremely helpful in order to be able to clear a blockage in this system. If you can't clear the blockage, if it's too dense, or if the tubes are too narrow, or if the hole isn't there, or anything like that, there's sometimes a surgery that's needed called a DCR. See if I get this right. Dacryocystorhinostomy. It's kind of a mouthful, but dacryocystorhinostomy. Basically, this is just a super drill gone inside the lacrimal sac to drill a hole in there and through the bone in order to be able to get that drainage system opened up a little bit more for tears to flow more readily down through the nose and to the back of the throat. Not usually first indicated to have the DCR procedure, but if you can't clear any blockage that might exist in the inferior punctum, the inferior canaliculus, or superior punctum or superior canaliculus, then you're going to need that. This is why it's important to talk to your doctor and ask if they do a dilation and irrigation, or if they know a colleague who does dilation and irrigation, because you're going to want someone that's very familiar with this and that does this consistently, frequently, and regularly in order to clear that blockage if you have too much epiphora or tears that are running down your cheeks. And too much tears means that the channel's blocked probably, or there's something else going on. But if we're talking about dilation and irrigation specifically, the culprit is usually a blockage in one of these drainage channels. The reason why we don't typically do a dilation irrigation of the inferior punctum, the anatomy is a little tricky, and usually gravity allows things to get stuck in the bottom canaliculus and an inferior punctum more easily than the superior punctum. And it's a lot easier to access those drainage channels in the lower lid than it is the upper lid, just by design and just by the way that we would push through it through a syringe, specifically saline, in order to clear that blockage out. Now let's talk about dilation eye drops specifically. So we talked about dilation of the inferior punctum and the entire tear drainage channel. Now let's talk about how dilation drops work. So there's two different muscles specifically this can work on, one of which is called the iris dilator muscle, and one of which is called the iris sphincter muscle. The iris dilator, it works like a clock in the sense that there are, if you look at your iris, it has multiple muscles moving outwards on it that, when stimulated, can increase the size of the pupil, the black hole in the middle of your eye that allows light to get to the back of your eye. The iris dilator works best whenever light conditions are low, or if you're really excited about something or someone. So the dilator will work when you need more light to enter into your eye in order for your brain to make sense of what's happening around you. The iris sphincter muscle works in that it's a circular muscle around the inside of the iris that basically makes up the edge of the pupil. So when that iris sphincter is stimulated, it will constrict and allow less light to go through. This can allow someone maybe to read better up close, maybe block out too much light. Like, for example, if my eyes are open right now, my pupils are going to be really small because it is incredibly bright outside right now. That's why I like sunglasses. Different dilation eye drops will work on these different muscles, whether it's tropicamide, phenylephrine 2.5 or 10%, cyclopentolate 1%, atropine, even homatropine, anything like that. They just do different things along the way. But specifically, you can have eye drops that can stimulate the iris dilator muscle, or that can block the action of the iris sphincter muscle. So this is kind of backwards thinking. And what I mean by backwards thinking is that if you want the iris dilator to work or not work, or the iris sphincter muscle to work or not work, you need to be able to either stimulate the dilator muscle or stimulate the sphincter muscle, or block the action of the dilator or block the action of the sphincter. So think about it. If you were to block the action of the iris sphincter muscle, what's going to happen? That pupil is going to open wide up because that sphincter action is blocked. If the dilator was to be blocked, what would happen? If you can't stimulate the iris and that dilator muscle is blocked, then that pupil is going to constrict because that dilator needs to open. So there's different ways you can dilate the pupil, whether it's by stimulating the dilator muscle or blocking the action of the sphincter, or some combination of both, because some dilation eye drops will have a combination of both of these. It's usually recommended to get your eyes dilated at your annual visit, or at least every once in a while, to check the peripheral retina, the area of the retina that's really hard to see, to make sure that there's no holes, tears, detachments, leaky blood vessels, anything like that. And there's a variety of dilation eye drops that eye care professionals will use to dilate the muscles or contract the muscles or block the action of those, to allow them to see their best, to examine your eyes properly, and to give you a complete comprehensive report to make sure that nothing was missed. Especially this is important in diabetes, because a lot of times diabetes can cause leaky blood vessels on the peripheral retina that is really hard to be seen on the typical eye exam, which is why dilation, yes, it's frustrating, it can take longer, and it's usually super bright and it's really hard for you to see afterwards, which is why if you're not comfortable driving, it's usually recommended that you have a driver ready for you to take you to and from your appointment. If you like this video, give it a thumbs up, subscribe to the channel, and tap the bell for notifications and to learn more about your eyes. I'm Dr. Bryce Heffington, and we'll see you next time.